awfully. At that time I didn't realise that we were going to win quite handsomely, so I was quite happy coming out of the stadium. But I was quite taken aback when I heard an interview taking place on RTE Radio 1 with Paul Cunningham. And it was a member of the NCP who was on the radio. And let's just say it had a real dampener on my day. I'm of the understanding that the programme for government commitment is to have an early access scheme. It's quite clear that the Minister is pushing in that direction, and she has repeatedly said so in the chamber. But for some reason, a member of the NCP thought it was okay to go on the national radio and basically comment about how he himself is against an early access scheme. So can I just ask maybe the HSE perspective on it, because ultimately you're the paymasters, it's up to you to sign off on these drugs, and if I can ask the department's position on it too, how do we marry those two things when a minister clearly is pushing one way and a civil servant is going on the airways saying something contradictory?
Okay, and then I'll hand over to HC. So look, as I said earlier to Senator Costello, very clear direction of travel in terms of policy terms, in terms of early access, both in terms of the 180 days, but also earlier access programmes for rare diseases. Professor Barry obviously gave a wide-ranging interview in relation to many aspects of the medicines process. And I think also raises sort of legitimate concerns, risks and issues that we know about in terms of earlier access. I think that's critical in terms of how we design it and the principles of design in terms of early access.
Okay, and I really do value the time in here because we're waiting 2 hours to come in. Is it appropriate that a civil servant will be going on the airwaves contradicting what the Minister has clearly stated is her objective? It was towards the tail end of it. You're right to say the interview, he covered a lot of bases. But just on that point, is that appropriate?
I think Michael Barry was on radio giving his independent view, I suppose, independent of the department and the Minister. The Minister's direction of travel is very clear, the policy is very clear. The work that we're doing in the department in collaboration with the HSE and indeed with the sector as well is very clear. So that's what we're turning our attention to.
Well, I can start reading statements from patients groups, whatever about the drugs companies themselves, the disgust that they felt over the last 2 days. I can start quoting from UCAN, IPOSI, I can keep going. They clearly aren't happy with the intervention. I just don't see how it can be deemed in any way appropriate. Maybe the HSE might want to comment on it.
I might ask Pat or Colin.
Just maybe at the outset, Deputy, I didn't hear the interview, but the transcript, and I'm not here to defend him or explain him. I haven't spoken to him about this. What he did say was he didn't support early access for all drugs, but for early access for drugs that have a proven overall survival benefit. He stated some support for it. But just it's important, rather than, if I could, Deputy, rather than focus on an individual, is this entity, the NCPE, performs a very important function for HSE and for drug reimbursement and for drug application, which is underpinned by legislation. And that legislation within which they have to operate, it demands that when they're assessing drugs, that there's a clinical need there.
Colin, sorry, no, it's the HSE that's tasked with that, not the NCP. The NCP has no statutory authority.
There is a process, Deputy, I promise I won't go on, but the NCP carry out this assessment on our behalf to deem whether a drug is clinically effective and cost effective, and that's something that's laid down by legislation in the Health Act of 2013. It isn't the NCPE contriving or making up a situation that they're deciding outside any legislative framework. That's laid down in legislation, that they must advise us based on the cost effectiveness and clinical effectiveness of a drug and on its overall budgetary impact and on its impact of the overall HSE resources. That's what they're bound to do.
My understanding of the legislation is the NCP isn't mentioned anywhere in it. It's the HSE that is that has that duty, not the NCP.
That is correct, Deputy. So what they do is they provide us with advice, and that goes to a drug group.
So can I ask you how often?
Ultimately, the decision of that drug group is either accepted or not accepted by the senior leadership of the HSE. And at times, I remember in late 2020, when the HSE leadership did not accept the advice. So ultimately, the decision goes through a governance through to the senior management team of the HSE.
Well, I'd have concerns about the governance of it, if I'm being truthful, and I've asked parliamentary questions about it in the past, so you're probably aware of it. I would have concerns about the governance of the HSE, the governance of the NCP. Like, to me, they're not accountable. There's no independent oversight as far as I can see it. There's no independent board of directors. Like, I hope that all this comes out in the wash in this review, and I welcome the fact that the Minister's commissioned a review. I welcome the fact that the Minister is listening to patients, to advocates, in terms of the early access scheme. But I'm genuinely, like, you can quote whatever column he said technically on the interview. It was quite clear what he was saying on radio. I would encourage you to listen back to it.
Deputy, could I just say that the drugs group, which advises him, takes submissions from advocacy groups and it takes those submissions very seriously. So when they're deciding, they consider not just the view of the NCP, but also the view of advocacy groups in the submission.
So, as part of the IFA agreement, which was recently signed and much welcome, it's committed to the 180 days. Now, in the same interview, like, it's going to take time to get to that. So, we finally recognising that we have never adhered to the 180 days as per the legislation. Because for a long time, like, we failed to recognise it. I would commend the likes of Teresa Costello and the Minister for their intervention on Jovinostat and the families, of course. But they demonstrated that in that particular process, it was done relatively quickly, in around 300 days, give or take. So it can be done, but that 300 days is still in breach of the 180 days as per the legislation.
It's interesting, we've 30 drugs have come through the process this year so far. Of those, 10 of them said the authorisation from the application from the company came within 90 days of authorisation from the EU. 7 of them, the application came 7 years after. 7 more, within 2 years after, and 7 more extending beyond 2 years. So 14 of the 30 applications were submitted by the pharma companies within 1 or 2 years after authorisation. So I think what Professor Barry was trying to make was that point, probably, that the agency fully recognises we have to improve our situation. We've committed to that. Myself and Niall were involved in the negotiations with the pharma sector. We fully accept that, and we've agreed that. The Minister had made it clear before we entered the negotiations about meeting the 180 days, and there's a process for that. But I think pharma companies also have to commit to improving their part of the process in terms of HTAs and the commercial negotiations.
Genuinely, I'm not here taking one side or the other. We just want timely access. We all talk about timely access, whether it's, you know, an appointment with a consultant, and in the case of these patients, we just want timely access to drugs. And to be honest, this kind of charade that goes on about, you know, blaming one another, I'm not interested in it really. But I was very, very offended on behalf of all the patients with Sunday. I genuinely need to listen back to the interview. It was quite obvious, the tone of the interview, what he was trying to do. Like, when an end-to-end review was just commenced, to go out and do that type of interview, like, is Professor Barry, for example, or the NCP more widely, maybe it's not fair to focus on him, will they be feeding into this review? Because if they are, they've quite clearly stated what their belief is on a fundamental part of what's going to inform that review.
So Deputy, maybe just on that point, and actually I'm happy to share maybe a note afterwards in terms of the scope of the review that's being commissioned. It's an independent review, so all stakeholders will have an opportunity to feed into it, but it is focused on every part of the process, from the company stage to the pre-application stage, right through to SLT stage.
I have 10 seconds, but just to be clear, so he's likely to feed into that, and his express aim was out for everybody to hear on Sunday.
So two things I'd say on that. All stakeholders will get an opportunity to feed into it, but the review itself is looking at the processes from an evidence basis and from a data basis. So we will be looking at that end to end, all aspects of it, and it will be independent.
I think the answer is yes. So finally, just Deputy Quaid, and we'll just take 3 minutes.
Thanks very much, Chair, and thanks to all the witnesses for being here